You can make a difference, even save someone's life, if you learn to recognize and respond to common emergencies. Hello, and welcome to the American Heart Association's Heart Saver First Aid course. In this course, you'll learn the basics of first aid, the most common life-threatening emergencies, how to recognize them, how to call for help, and how to perform life-saving skills. This course will help you learn in several ways. Your student workbook covers all the materials and includes quick reference guides. And this video gives you facts and shows you important skills. However, not all topics are covered in the video, so it's important to read your workbook to learn about additional topics. If you complete all the course requirements and demonstrate the skills correctly, you will receive a course completion card. Studies show that you need to review this information frequently to maintain your first aid skills. Now, let's see how training in first aid can help you save someone's life. First aid is the immediate care that you give a person with an illness or injury before advanced training arrives and takes over. First aid can be initiated by anyone in any situation. It may help someone recover more completely or more quickly, and it could mean the difference between life and death. Most of the time, you'll give first aid for minor illnesses or injuries, but you may also give first aid for something that could become life-threatening, such as applying a tourniquet for severe bleeding or giving epinephrine for a severe allergic reaction. Let's define some terms you'll hear throughout the course. Responsive refers to someone who moves, speaks, blinks, or otherwise reacts when you tap them and ask if they are okay. Unresponsive refers to someone who does not move, speak, blink, or otherwise react. You should know that during an emergency, it is possible that someone might become unresponsive. If you haven't had any training in CPR and you aren't learning it today, hands-only CPR is recommended for use on teens or adults whom you see suddenly collapse. To provide hands-only CPR, phone your local emergency response number and push hard and fast in the center of the chest at a rate of 100 to 120 compressions per minute. During an emergency, the emergency dispatcher may be able to instruct you on how to give hands-only CPR. For more information on hands-only CPR, go to international.heart.org. Refer to your student workbook or ask your instructor. In this course, we will tell you when you may need to provide CPR. If you know how to provide conventional CPR, which is compressions and breaths, provide that. If you don't know conventional CPR, provide hands-only CPR. When you give first aid, you or someone else will need to get the first aid kit and an AED. An AED can be used along with CPR. The AED, or Automated External Defibrillator, is a lightweight portable device that can identify an abnormal heart rhythm that needs a shock. The AED can deliver a shock that can help convert a rhythm back to normal. AEDs may be found in public locations, especially high-traffic areas such as airports, shopping malls, and casinos. It is very important that you become aware of the location of the nearest first aid kit and AED so that you may provide the best possible help to someone who is ill or injured. As part of First Aid Basics, your role as a first aid rescuer is to recognize that an emergency exists, make sure the scene is safe for you and the ill or injured person, phone your local emergency response number, and provide care until someone with advanced training arrives and takes over. You become an important part of emergency medical services, or EMS, when you phone your local emergency response number. Another first aid basic that applies to almost all emergencies is to ask if you may help. Anyone has the right to refuse help. When you come upon an ill or injured person and the person responds, introduce yourself and ask if you may help. If the person wants help, give first aid specific to the illness or injury. If the person does not want help, ask them if they want you to phone your local emergency response number. If they do, phone your local emergency response number and stay with them until help arrives. If the person is confused or can't answer, assume the person wants help. It's important to know that first aid kits should contain supplies you'll need in most common emergencies. Your student workbook contains a list of what is usually kept in a kit. Each kit may be different, however, so if you are in charge of the first aid kit, please check your list to see if there are additional items you need to add. The list divides recommended first aid kit supplies into two categories, Class A and Class B. Class A kits are suitable for homes or smaller workplaces. Class B kits are for larger workplaces and are designed to treat injuries more often found in densely populated workplaces with complex or high-risk environments, such as warehouses, factories, and outdoor areas. Use your best judgment on what class is most suitable for your location, and always be sure to restock the kit after an emergency. Initially, you may be hesitant to act in an emergency. You may be worried about doing the right thing, or worried that someone else could provide better care, or even the sight of the injury might be overwhelming. You never know when you might encounter an emergency where you are the only one that can help, and your first aid actions may make a huge difference in the life of someone in need. After completing this course, your confidence and ability to respond in emergency situations will be greatly increased. You'll be more likely to help if a family member, coworker, friend, or even someone you don't know becomes ill or injured. And if you have questions about whether it's legal to provide someone first aid, Good Samaritan laws are in place. These laws protect anyone who provides first aid. For more information on Good Samaritan laws in your area, check your local government's website. For you or the ill or injured person, move an injured person only if they are endangered or if you need to move them to safely provide first aid or CPR. Should you move an ill or injured person? Most of the time, no. This is especially important if you suspect that the person may have a pelvic or spine injury because moving them could worsen the injury. However, in certain situations, you may need to move a person for safety reasons or to provide first aid effectively. You should do this only when the current area is unsafe for you or the ill or injured person, or it is unsuitable to provide first aid. For example, if there is a fire, you need to get yourself and the person to a safe location. Also, some emergencies may happen in confined spaces, like a car, and you may need more space to provide effective first aid. If you do need to move someone, here's one way to do it. Drag the person by the clothes. Place your hands on the person's shoulders, grab their clothes, and pull them to safety. Are others around to help? If so, have someone phone your local emergency response number and get a first aid kit and AED if one is available. If no one else is near, phone your local emergency response number yourself and put your cell phone on speaker mode if available. Be prepared to provide information to the emergency dispatcher about who is ill or injured, how many people are hurt and what happened, and your location and how to get there. If there are other bystanders, send one of them to meet the paramedics and lead them to the scene. As you assess the need for first aid, it's important to know when and how to phone for help. As a general rule, you should phone your local emergency response number and ask for help whenever someone is seriously ill or injured, or you're not sure what to do in an emergency. Here are some examples. The person doesn't respond to voice or touch, has chest discomfort, signaling possible heart attack, has signs of stroke, has a problem breathing, has a severe injury or burn, has severe bleeding, has a seizure, suddenly can't move a part of the body, has received an electrical shock, or has been exposed to poison. You will learn more about the signs and first aid actions for these medical and injury emergencies later in the course. As you assess the scene for safety, there are universal precautions you should take. These precautions are called universal because you should treat all blood and other body fluids as if they contain germs that can cause disease. Your first aid kit should include personal protective equipment, or PPE, such as eye protection and medical gloves. While you are giving first aid, PPE keeps you safe from blood and other bodily fluids, such as saliva and urine. Additionally, eye protection can help shield you from chemicals or poisons that may be nearby. First aid kits may also contain a pocket mask for giving breaths in case you need to provide CPR. And because some people are allergic to latex or have developed sensitivity to latex that can cause serious reactions, you should use non-latex gloves if at all possible. As a reminder, if you are in charge of the first aid kit, remember to keep it stocked with all of these items and the additional items listed in your student workbook and to restock after any of the supplies are used. While the AHA always recommends the use of PPE, and this course will often show PPE being used, it's possible you may find yourself in an emergency where PPE is unavailable. In this situation, use your best judgment for how to render first aid. You should always wear PPE whenever there is visible blood or other body fluids. However, if the person's blood does make contact with your skin or splashes in your eyes or mouth, take these steps. Remove your gloves if you are wearing them. Immediately wash your hands and rinse the contact area with soap and lots of water for 20 seconds. Rinse your eyes, your nose, or the inside of your mouth with plenty of water if bodily fluids splattered in any of these areas. And report to a healthcare provider as soon as possible. If the person is breathing very slowly, is having trouble with every breath, has noisy breathing, you hear a sound or whistle as air enters or leaves the lungs, or can only make sounds or speak no more than a few words at a time in between breaths, even though the person is trying to say more. People with a medical condition such as asthma usually know about it. They often carry an inhaler, which is a device that contains medicine that can help them breathe easier within minutes of using it. Most people who have asthma are familiar with their inhaler and will not require any help in using it. However, at times, the person can have such a hard time breathing that they need help using their inhaler. So, it's important to be familiar with how inhalers work. There are different types of inhalers available, but the most common one is a metered dose inhaler, or MDI. Here are the steps to take in using this type of inhaler, just in case you end up needing to help someone. First, remove the cap and shake the inhaler well. Have the person breathe out all the way. Place the mouthpiece of the inhaler between their teeth and have them seal their lips around it. As they start to breathe in slowly, press down on the canister one time. Have them breathe in as slowly and as deeply as they can for about 5 seconds. Count to 10 to allow the medicine to reach the airways of the lungs. Repeat the steps above for each puff indicated on the inhaler, generally 2 puffs total. Replace the cap on the inhaler. Inhalers may also come with a separate apparatus called a spacer or chamber, which is an oval plastic container that attaches to the mouthpiece of the inhaler. If the person's inhaler has a spacer, attach it to the mouthpiece of the inhaler after shaking, but before having the person breathe out all the way. If the person is having a hard time breathing and has no medicine, does not get better after using the medicine, has worse breathing or trouble speaking, or becomes unresponsive, you will need to phone your local emergency response number and wait with the person until help arrives. Be prepared to give CPR and send someone to get an AED if the person becomes unresponsive while waiting for help to arrive. Caused by food blocking the airway. The block in the airway may be mild or severe. We've all been in a situation where food or drink gets caught in our throat, making it difficult to swallow or even breathe for a few seconds. These situations are called mild airway blocks and are normally relieved without intervention. If a block is mild, a person can make sounds and cough loudly. When this happens, you may want to help, but it's best to stand by and let the person cough. If you're worried about the person's breathing, phone your local emergency response number. If the block in the airway is severe, then the person cannot breathe, talk, or make sounds. The person may also make the choking sign by holding their throat. If this happens, you need to act right away to try to clear the airway. To help in this situation, you will give abdominal thrusts slightly above the navel. Each thrust pushes air from the lungs like a cough. This can help remove an object blocking the airway. If you think a person might have a severe airway block, follow these steps. Ask if the person is choking and if you can help.
Are you choking? Can I help you?
If the person nods that they are choking and can't talk, you need to add. You'll need to give thrusts slightly above the navel. Depending on your size and the size of the person choking, stand firmly or kneel behind the person and wrap your arms around their waist with your fists in front. Make sure to position yourself so that you are stable in case the person collapses to the ground. Some people find it helpful to stand with your feet shoulder width apart and one leg slightly forward. This creates more stability. Make a fist with one hand. Put the thumb side of your fist slightly above the navel and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. Give thrusts until the object is forced out and the person can breathe, cough, or speak. An adult who has been given thrusts should see a healthcare provider as soon as possible. Let's look one more time at how to make a fist. Make a fist with one hand. Put the thumb side of your fist slightly above the navel and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. If the person is pregnant or very large, you will need to change how you relieve choking. Put your arms under the person's armpits and your hands on the lower half of the breastbone. Pull straight back to give chest thrusts instead of abdominal thrusts. You can also use this technique for someone in a wheelchair. If you give someone thrusts but cannot remove the object blocking the airway, the person will become unresponsive. In this case, you need to give CPR, but there are a few differences. First, you'll need to get the person safely onto a firm, flat surface. This can be challenging, especially if the person is much larger than you. The best technique is to slowly walk backwards and allow the person to slide toward the floor until they're flat on their back. As you've already learned, when a person becomes unresponsive, shout for help. Phone or have someone else phone your local emergency response number and get an AED if they haven't already. Put the phone on speaker mode so that you can talk to the dispatcher. Provide CPR starting with compressions. After 30 compressions, open the airway and quickly look in the mouth. If you see an object in the mouth, take it out. Do not attempt to reach in and pull anything out that you can't clearly see. This is known as a blind finger sweep. Doing a blind finger sweep may cause the object to become lodged farther back in the airway. Remember, you want to minimize interruptions in compressions to no more than 10 seconds. After checking the mouth, give 2 breaths. Keep repeating the sets of 30 compressions and 2 breaths. Each time you open the airway to give breaths, look for the object in the back of the throat if you haven't already found it. Continue CPR until the person speaks, breathes, or moves, or until someone with more advanced training arrives and takes over. Symptoms of a mild allergic reaction are stuffy nose, sneezing, itching around the eyes, itchy skin, or a rash. However, some reactions that seem mild at first can become severe within minutes. A number of things can cause a severe allergic reaction, including eggs, peanuts, chocolate, some medications, and insect bites and stings, especially bee stings. The signs of a severe allergic reaction are trouble breathing, swelling of the tongue and face, and signs of shock. An epinephrine autoinjector is a prescribed device that has a dose of medicine in it. The autoinjector will help a person with a severe allergic reaction breathe more easily. If a person has an epinephrine autoinjector, they will generally know how and when to use it. If the person needs help administering an epinephrine injection for which they have a prescription, Good Samaritan laws allow for you to help, providing you act in good faith. Now, let's watch a demonstration of a person administering an epinephrine injection to someone else. First, make sure the scene is safe. Phone or send someone to phone your local emergency response number and get the first aid kit and the AED. To use the epinephrine pen, follow the instructions on the pen and make sure you are holding the pen correctly. Hold the pen in your fist without touching either end because the needle comes out of one end. Press the tip of the injector hard against the side of the person's thigh, about halfway between the hip and the knee. Give the injection through clothes or on bare skin. The leg should remain still while the needle is in place. Pull the pin straight out, making sure you don't put your fingers over the end that has been pressed against the person's thigh. Either the person getting the injection or the person giving the injection should rub the injection spot for about 10 seconds. Note the time of the injection and give the pin to paramedics for proper disposal. If the person doesn't get better and there is a delay of greater than 5 to 10 minutes for advanced help to arrive, consider giving a second dose if available.
So these are.
The symptoms that they discuss.
What is this
Some
focus?
contact symptoms may
They're
feel
really
like
answering.
reflux or indigestion and technically not be seen. This is especially common for women who may mistake a heart attack for normal aging or fatigue. It's important to be aware of the signs and symptoms of a heart attack because the sooner it's treated, the less damage there is to the heart. If you suspect someone is having a heart attack, you must act and phone your local emergency response number right away, even if the person doesn't want to. One of the main signs of a heart attack is chest discomfort. Most heart attacks involve discomfort in the center of the chest that lasts more than a few minutes or that goes away and comes back. It can feel like uncomfortable pressure, squeezing, fullness, or pain. Discomfort may also appear in other areas of the upper body. Symptoms can include pain or discomfort in one or both arms, the back, neck, jaw, or stomach. Other signs of a heart attack include shortness of breath with or without chest discomfort, breaking out in a cold sweat, nausea, or lightheadedness. But what about the difference between a heart attack and cardiac arrest? We often hear these two terms used as if they're the same, but they're not. When a person is in cardiac arrest, they need CPR immediately. When a person has a heart attack, their heart is still beating and they need a different kind of help. If someone has signs of a possible heart attack, do the following. Make sure the person stays calm and rests. Phone your local emergency response number first so that help can arrive quickly. Ask someone to get the first aid kit and an AED. Once the first aid kit arrives, if the person has no allergy to aspirin, no serious bleeding, and no signs of a stroke, have the person chew and swallow 1 adult or 2 low-dose aspirins. If the person becomes unresponsive, be prepared to provide CPR and use the AED. Remember that during a heart attack, giving aspirin appropriately can make a big difference in the person's quality of recovery. Especially if it's hot, has a heart condition, suddenly stands after squatting or going down, or receives bad news. Fainting is when a person briefly stops responding, usually less than a minute, and then seems fine. This is usually caused by not enough blood going to the brain, causing a loss of consciousness. A person will usually get dizzy before fainting. If you need to give first aid for a person who is dizzy but still responds, help the person sit or lie flat on the floor. Don't let them get up too quickly, and ask them to put their head between their knees if they're sitting. There are also some movements a person can do that will help prevent fainting. If a person is lying down, have them cross one leg over the other and tense their leg, abdominal, and buttocks muscles. You can also have them lower their body into a squatting position and tense their abdominal muscles. If someone faints, make sure the person is on their back. Make sure the person is breathing and has no injuries. If the person stays unresponsive for more than 1 minute, you'll need to phone your local emergency response number. If you suspect a head, neck, or spine injury, don't move the injured person. If the person faints and then starts to respond, make sure they don't get up too quickly to avoid fainting again. If the person fell and injuries occurred, give first response number and begin CPR.